Và ngay sau bức tranh tổng quan về nhiều đất nước trên thế giới thì chúng ta cùng đi sâu hơn vào một trường hợp cụ thể, đó là mô hình Charter 70/2028 tại Slovakia. Đây là câu chuyện của quốc gia đã tạo nên một cách mạng trong quản lý tăng huyết áp khi từ chỗ chỉ có chưa đến 50% bệnh nhân đã được kiểm soát với mức huyết áp là 140/90 thì Slovakia đã vươn lên một tầm cao mới chỉ sau một vài năm thôi nhờ vào một chiến lược rõ ràng và sự đồng hành của toàn hệ thống. Và người chia sẻ của chúng ta hôm nay chính là kiến trúc sư trưởng của dự án đó. Xin chân kính mời giáo sư Anna Pakulova, phó chủ tịch hội đồng quốc gia hiệp hội tăng huyết áp Slovakia và trình bày Charter 70/2028 mô hình quản lý tăng huyết áp tại Slovakia. Xin cảm ơn.
Good morning. Xin chào quý vị. It's a great honor to me to stand in front of you in this very important French-Vietnamese medical forum. I would like to express my sincere gratitude to Sevier Vietnam and Sevier Global to invite me to your beautiful country and your beautiful city. Before I start my presentation, I would like to share you why I accepted your kind invitation. It's not just because of the professional reason, because I am really proud what we have already done in Slovakia, but also I really accepted from your invitation from my heart. So my first contact with the Vietnam was via my family. In Slovakia, we believe that everything starts in family, and my father, he was a professor of physics in University in Bratislava, and one of his PhD students was from Vietnam. It was a very smart and very hard-working lady, and she told me about Vietnam, about your country, and today I'm standing here in your beautiful city, in your beautiful capital in Hanoi. So this is my personal reason why I am here. I would like to share with you Slovak experience, how we manage hypertension in Slovakia. I would like to share with you not just story about hypertension. I would like to share with all of you how shared vision, measured goals, and multidisciplinary cooperation could transform healthcare outcomes. So this is why we are here, and this is what we would like to do, because hypertension and or cardiometabolic risk factors are not just risk factors, but they are really destroying our population and really increases the avoidable deaths all around the world. Before I start to explore our program of Charter, let me start with some numbers. Let me start about some facts about our countries. So, Slovakia and Vietnam, different countries, different geopolitical locations, different numbers according to the population and capital as well. But when we look at these two countries at once, we could clearly see that there is one extremely big problem. The name of this problem is hypertension. And not just hypertension prevalence, but mainly hypertension control, because this is one of the leading risks of cardiovascular mortality and other mortality, not just in our two countries, but all around the world. I would like to go through this comprehensive overview in our two countries and look at what are our very positive things and what are our gaps in the diagnosis, treatment, and follow-up in our patients. In both countries, we could really high rising prevalence of hypertension like a non-communicable disease. We have real diagnostic gaps in both countries, and we would like to improve the control rates in both countries, and we would like to implement not just classical view of management of this disease, but also according to the latest trends improve via digital transformation and using digital data, and we have real national strengths to improve and to be better in hypertension and other cardiometabolic risk management. I would like to start to explain why charter in Slovakia. It has a real historical roots that the charter in former Czechoslovakia, that means a commitment, a pledge to when you sign something like a charter, this is your personal declaration that you belong to such a community and that you would like to go for a goal. So that's why we already decided, okay, let's improve hypertension management. We are signing the charter program and to improve the hypertension management in Slovakia and to put clear goal, which could be 70% control of hypertensive patients to target reach values by the years 2023. So that's why the historical inspirations gave us the way how we could manage hypertension in Slovakia. When it begins? It began after 2018 ESCH and ESC guidelines on hypertension. Slovakia entered this year 2019 with very negative cardiometabolic risk profile and also very high prevalence of hypertension and also with therapeutic inertia from the part of the healthcare providers. So we also entered this year 2019 with high mortality rates of cardiovascular disease and also of high rates of the stroke. So that's why we had to act, and we also declared it like a charter 70/2023, like a declaration that we would like to all societies managing patients with hypertension and patient organization as well for better control of patients with hypertension in Slovakia. So this is the charter as it was released in the National Conference of the Slovak Society of Hypertension, and at that time it was signed on the current president of the Slovak Society of Hypertension, Slovak Society of Cardiology, Slovak Society of Internal Medicine, main expert in cardiology, main expert on GP, and also from the patient organization. What we have done? We clearly focus on the gaps, on the education, on home blood pressure monitoring, and on systematic follow-up. Well, we started education of our colleagues, of the GPs and specialists, because we would like to put all that competencies by the management of hypertension, hyperlipoproteinemia, and diabetes type 2 to the GPs. So we organize various types of seminars, School of Hypertension, to educate our colleagues. We also educated about ABPM and other modalities, how to improve management of hypertension. And they were always overcrowded, and our colleagues were very satisfied. We also increased the awareness of hypertension in a general population. We went to many broadcast TV and other social media to increase that hypertension. It's not just the number on the device, but it's a real risk factors and real disease in combination with hyperlipoproteinemia, obesity, overweight, and diabetes type 2. Then we continue the cooperation with the patient organization, because without patient support, we couldn't be able to go through all that barriers. So we educated our patients and we sent them emails, we invited them to the webinars, seminars, and trying to educate them not just about hypertension, type 2 diabetes and dyslipidemia, but about proper blood pressure management, about proper management of hypertension and other risk factors, And we would like to share it with also other new patients with cardiovascular diseases in Slovakia. In 2021, when I became a president of the Slovak Society of Hypertension, we also started the project May Measurement Month in Slovakia, as you could already share it with also in Vietnam. But you know, our Slovak numbers are really, comparing to yours, smaller, as we are smaller countries, but I am really proud as a national leader of MMM in Slovakia, but we really obtain really good numbers also in these activities. We also provided nurse involvement, because nurse is very important part of the hypertension management all around the world, not just in Slovakia, because nurse could clearly educate the patient, and of course, patient-doctor relationship is very important, but also nurse-patient relationship is sometimes stronger and with less barriers comparing to the doctor's relationship. And then we involve also pharmacists. You've seen some also in the presentation of Professor Atul Patak that also pharmacy part is very important in Slovakia. We also involve them to the blood pressure management at the School of Pharmacy at the Comenius University. We established how the subject how to measure blood pressure and about hypertension management in pharmacies. We trained all the pharmacists how to improve it, and we also involve pharmacists to the project MMM in Slovakia. So, and every year from the project charter was released, we started a project with home blood pressure monitoring. We involve GPs and specialists on that time to include their patients with already diagnosed hypertension to the project of home blood pressure monitoring. There were 2 visits, one at the beginning and one at the end of the project. Patients were educated, they measured their blood pressure, and then patient was managed as always. And during the 7 days, the patient provided home blood pressure monitoring, and after that 7 days, there was a final visit with the blood pressure measurement. You could see very simple project, but very simple outcomes are that one that could change the global outcomes. And you could clearly see the numbers that after 7 days of home blood pressure monitoring, there were decrease of the blood pressure minus 5.5 over 3 millimeters of mercury in the patient's home blood pressure monitoring. You could say just small numbers. I could agree with you. Small numbers, but with great impact, because at the end of the day, these small numbers could have impact on the patient's health, on the patient management, and about the patient active approach to their disease, that they have to improve their inside blood pressure, not because of the doctor, not because of the nurse or pharmacist, but because of themselves. So even small numbers could really have big impact. So these are results of our project charter, which was released in 2019 until the 8th, 2023. You could clearly see that at the beginning there was 46% of the patients with hypertension who were controlled, and the tight control of the blood pressure had 25% of the patients. At the end of the project, in 2023, we were so satisfied because we really obtained 74% of the blood pressure control and 38% of the tight blood pressure control. Really miraculous results on one hand. But on the other hand, I have to tell you that it was not like global project. In Slovakia, we included just part of the doctors, part of the patients, part of the GPs, part of the specialists. So that's why we cannot be satisfied with these levels, but it was just the first step, and we would like to continue to improve the management of the patients with hypertension and other cardiometabolic risk factors in Slovakia. So that's why we started another project, another edition of the project Charter 70 about 2028. more ambitious project, more activities, and even more people and more societies were involved. Moreover, we involve Ministry of Health of Slovakia. So this is our model, and that's why I really recognize your step to going to Ministry of Health and to ask them for your support, because without this one, without including authorities to the project, it wouldn't be possible to go and to obtain successful goal of the project. So, in 2024, it was fully restored with Charter 70/2028. You could see it was signed by the Ministry of Health, President of the Slovak societies, me, hypertension, cardiology, internal medicine, patient organization as well. We also included the Dean of the Faculty of Medicine, Faculty of Pharmacy, GPs, and also nurses, because we would like to say all societies project. So this was extremely important to have more important. So that's why that was a systematic process and systematic activities what we would like. We continue in our education, but we more emphasize for adherence to the treatment, for prescription of single pill combinations, and implementation of the guidelines to our everyday practice. So it was the project on the GP specialists, we included hospitals and also authorities. So our project was also recognized at the level, not just about the parliament, but also about Madam President of Slovak Republic, Madam Zuzana Čaputová. We also compare our data from our other leaders from around the world. So that's mean not only Europe, but also Australia. You could see clearly Professor Aleta Šute and other colleagues from other countries in Europe. What we have learned? First of all, we were speaking about the patient adherence and emphasizing patient-active approach to their treatment. What's the real problem in Slovakia? That patients with hypertension are not consistent in their treatment. I would like to share with you one case report from my country. This is the story of a specific patient. So you could clearly see he started the treatment for several times from the year 2014, and he suffered from months or years of holidays from the treatment because of his decision. Even though he was already asked by his GP, let's continue in the treatment, patient stopped the treatment and restarted once again. It remains as the story 50 first days. So this is the story about the adherence of the patients. So that's why we have to support the adherence of the patients. On the other hand, we have to continue to improving adherence our physicians to the guidelines. So that's why we educated them about single pill combinations, and you could clearly see that in Slovakia we have 265 categorized products in single pill combinations according to the guidelines. So that's why it's real good reason why to use single pill combinations. Moreover, we have very good electronic health system which clearly see the prescription of the drugs, the dispensation of the drugs from the pharmacy, and also we involve healthcare insurances companies in Slovakia to support our charter and to be active in this, to active participate. And this is the hypertension market in Slovakia. You could clearly see that after the releasing the project of the charter in 2019, there is an increase in the prescription of the single pill combination, almost 5%. Relatively small number, but on the other hand, you could clearly see that there is really decrease on the prescription other drugs which were not the first-line treatment according to the European guidelines of management of hypertension. So this is the real impact of the guideline implementation in Slovakia. So what are our future directions? We would like to continue in education. All patients, all healthcare providers, also pharmacists and nurses about management of hypertension, and we would like also to implement these activities to decrease the numbers of the acute coronary syndromes and acute strokes in Slovakia. We also included hospitals to our project charter. So that's why we also started a pilot project in 5 hospitals in Slovakia to increase the prescription of the single pill combination during hospitalization, not due to hypertension, but other reasons. And it really works when they really look to the patient prescription of the antihypertensive drugs. We continue our cooperation with Ministry of Health. We also signed the memorandum about the cooperation, and every year we continue to follow up at the Ministry of Health. I already mentioned that in Slovakia we have relatively high numbers of stroke. So that's why we started the project with young kids at the primary and secondary school. The project was called Fast Heroes. So it was how to recognize the stroke and how to decrease the stroke and other cardiovascular outcomes via education about the risk factors. So it was also endorsed by the Ministry of Health and Ministry of Education in Slovakia. So that was the project Fast Heroes. We educated more than 30,000 students at primary and secondary school. This year we released another school education program, 5 challenges, really continue at the education of the risk factor, and we also continue in the project May Measurement Bank. So, and also we found using a telemedicine we couldn't be able to survive the hypertension. These are results of our pilot project of using single pill combination in the treatment of newly diagnosed hypertensive patients. And you could clearly see that within 3 months, using single pill combination in the initial doses by perindopril, arginine, and indapamide, you could clearly control up to 96% of the hypertensive patients without visiting a doctor. So you could see that there was a consistency across all levels about the public control of hypertension in MMM, about the GPs from the home blood pressure monitoring, specialists as well, and hospitals as well, and as one, we can really achieve more. At the end of my presentation, I would like to focus to Vietnam and Slovakia, the similarities. Another comprehensive overview that could really compare our countries. That was Slovakia data before the charter was released and the Vietnam data. The same starting challenge. There were also awareness of patients and about the same problem about the adherence to the treatment. We have to improve the care model of hypertension, and we also ask stakeholders to continue in their support to improvement of the hypertension. What I already identified in your perspective, in your benefits, there are accelerated impact potential because you could really grow very fast to improve the hypertension and other cardiometabolic risk factors in Vietnam. I would like to mention also Slovakia-Vietnam cooperation framework. So the first cooperation was signed already back in this 1950s. So on that time there were also some cooperation between Czechoslovakia and Vietnam. Nowadays, in Slovakia, we have around 7,000 people, Vietnamese people, they live here in Slovakia, and it's a real minority in Slovakia with their old race and culture and other habits. So this was something what was done, and also in April this year, our Prime Minister visited your country and signed a lot of cooperation declaration between Slovakia and Vietnam, so we would like to continue in our cooperation. Dear ladies, dear gentlemen, I would like to conclude the project charter. It's not only a program, it's a pledge, a collective commitment to better cardiovascular health. We would like to overcome inertia and engage patients at all levels, healthcare professionals, also health insurance companies and all authorities to improvement management of hypertension and other risk cardiometabolic risk factors, not just in Slovakia and Vietnam, but all around the world. Thank you very much for your attention. Xin cảm quý vị đã lắng nghe. Thank you.
Rất tuyệt vời ạ. Thank you.